now left to right.
All right. Good morning, everybody. It is your last day of lecture. Yay! Everybody should be happy. What can I say? This is I always seem to be teaching on the very last day, and it's probably my favorite time to teach because everybody is in a super, super good mood. And now they're not going to have to sit through a lecture again. So I'm going to try to do my usual thing. And we're going to try to make this very simple. I know you guys are studying for your test next week, and you're going to get this as the last. So I wanted to make a really good impression on you so you will not have to like study, since you don't have but a couple of days to go over this. And basically, if you follow the SLOs, you should be perfectly fine for this test. You know how I kind of I like things very simple. So that's what we're going to do. And
Miss
most,
Dixon,
yes,
are y'all doing Final Jeopardy Monday?
I think so. I haven't talked to Wendy, but I think we're supposed to start at 10.
Okay, thank you.
As far as I know, it's on the schedule. So everybody better be there on Monday. It's going to be on Zoom, and it's going to be about 2 hours, I think. And it is a really good review. It's a great way that it'll help you where you are missing some things and you go, oh gosh, I forgot that. So I hope to see you there on Monday. And it's really a fun game to play. And it's very, very informal. All right. All of you guys, I'm sure this has been a very good experience the last couple of years. All of y'all were the COVID children, as they say. And oops, hold on. Somehow or another, I got lost. Oh, it clicked me out. Hold on. Sorry, guys. I sure hope the rest of the day doesn't go like this. It just like disappeared. Y'all disappeared. It's a little early to start disappearing on me. Living in Louisiana, you guys have done this for years over and over. And like I said, with COVID and the hurricanes, you are probably the most prepared students for this lecture today. These are things that you have done all the time. It's nothing new. There may be a couple of terms that you need to know, but all in all, I think you're going to be able to put this together. Now, we're going to cover some principles of emergency preparedness. We're going to discuss the 4 phases of an emergency. You know those 4 phases. You have heard them every day. Then we're going to talk about your role and your responsibility of a nurse during an emergency response. We're going to try to cover all those things in the first half hour. The second half hour, we're going to discuss triage. And we're going to go through triage. I'm going to try to make that as simple as I can for you. Then the third part is going to be some category 1 bioterrorism. And then the second part of that is going to be radiation contamination for a nurse. If you remember, if I ask you guys what a pandemic is, you guys would know. When I asked this question and the students had to decide between a pandemic and an epidemic on the test, they missed it. A lot of them missed it. They thought an epidemic was worse. But so that's easy for you guys. A typical emergency is like right now, if you cannot get on the internet or you lose your connection, I consider that an emergency. If you get in a car wreck down the street, that's an emergency. Then we move up to a disaster. That could be like a mass casualty disaster. It's more than one, it's a group. Then we're at a pandemic, and a pandemic is worldwide. It is a worldwide disaster. And this one, I am sure you know, like I said 2 years ago, this was a question people always missed or misunderstood, and that was surge capacity. Every one of you should know what surge capacity is. Just by COVID, remember, we had such a huge surge of COVID patients that we were busting out the seams in ICU. We had more people than what we could take care of. And that's something that you definitely don't want. In emergency preparedness, you guys know you set up your plan, you figure out how you're going to prevent it and how you're going to recover from it. And the CDC recommends that you have this preparation training, and you need to be trained in various different ways of an emergency. So before we get into that, let's go through some of these people, which I'm sure you guys all know too. Agencies that are involved with emergency management and response. FEMA. Everybody knows who FEMA is. Homeland Security. Center for Disease Control, CDC. CERT, what we call Community Emergency Response Team. And COCA, COCA, which is Clinical Outreach Communication Activity. Community Emergency Response Team, who would you think that would fall into that group in the state of Louisiana? Anybody have a guess?
Governors and mayors, political officials.
Okay,
Coast Guard,
getting close.
the Cajun Navy.
Cajun Navy. That's another question that if I would have asked you when I asked students 2 years before all of this, they were not quite sure who the Cajun Navy is. Now that is a community response. Now, I know you guys hate to list things and have to know phases, but this is one of the things you will have to know for this test. And it's your 4 phases of an emergency. But you know this, the first phase of an emergency is the mitigation phase. This takes place before and after the emergency happens. We're going to identify some potential hazards. We're going to try to prevent some reoccurrences. And we're going to try to minimize those effects that we cannot prevent. Examples. Everybody here knows you got to get your flood insurance 30 days before storm season hits. So those people that are living in flood zones, they know that they need to purchase flood insurance. We develop public warning systems for tornadoes. Some of us create storm basements. Now I think everybody is buying generators than has ever bought before. And also in this mitigation phase is legislation related to mandatory evacuation. And what that is, you guys know whenever we go into contraflow, which highways are going to go this way, which ones are going to go that, which districts we start evacuating first. So you know mitigation. You just probably have never heard it called mitigation. The second phase that you're going to have is a preparedness phase. And this is where your risks are assessed and your plans are developed to address those risks. This is where you got to develop proper procedures and adequate emergency equipment, such as fire extinguishers, flashlights. Some examples of the preparedness phase was when FEMA was developed in 1979, and Homeland Security was created in 2001. And of course, we know the CDC. All of this is in the preparedness phase. You're going to be checking to make sure your equipment is working. You're going to be checking to make sure you have batteries, that you have no expired dates on things. If you're working in the hospital, they're going to have you out there checking all the expiration dates of stuff. The third phase is the emergency response. And this is implementation of that preparedness plans that you made. This is plans that provide the means for responders to save lives. And this is when they meet basic human needs. As soon as possible, disaster victims are triaged and given appropriate treatment. Search and rescue operation shelters and repairing like utility structures. The very last phase is the recovery phase. And this is the phase that's designed to return your community back to normal or create new, safer normals. Here you're going to have rebuilding, reemployment, repair, reconstitution of government operations, storage of food, even home confinement, medicines, and other essential items. This also in the recovery phase includes, after epidemics or wars, the building and the repair of a community and everybody going back to work. Now, all these four phases, think of it as a circle. It's actually in a constant circle. You're constantly in recovery. Some of us that did not have any damage to Ida, we're already done. We don't have any recovery. There are other people that are still in the recovery phase because they're still working on their houses. Now, those of us that didn't have any damage, we are now moving into that mitigation phase. We're planning what we need to do. We're buying our generators. We're buying all of these things, getting ready for whatever. So, you know, when you've been here, everybody here has their hurricane bag. You got it packed. You know what to pack in it. Remember, it used to be 3 days worth of stuff. Now the recommendation is 2 weeks, just to let you know. The other thing that you got to know that's really important is what your role and responsibility is during these phases. And what could happen to you during these, especially if you're a nurse that has not lived through any of these disasters. And the ANA describes your nursing role. It's very complicated. It's got a lot of stuff in it, but I am going to break it down for you for what I want you to know. And what I want you to know is that when you go to work somewhere, they're going to have you sign a hurricane paper, disaster paper now, because COVID is going to be in there, to where they have activation and recovery teams during a disaster. Think of it very, very clearly which one you want to do. You cannot change the morning of or the week of. These, like I said, this is mitigation. These are planned months in advance. If you say, well, okay, I'll do this, and then you decide that morning, you know what? This hurricane is going to be a 5. I'm getting out of here. You can't do that. Your employer can fire you. In Louisiana, nurses are going to back you up on it. You cannot leave during that disaster if that's what you were going to do. I suggest those of you who have never worked in hospitals sign up, that have children and dogs and grandparents and responsibilities, to sign up for a recovery, because you will come in after everything is restored. Activation is usually people that are single or have no children or have no pets, nothing that they have to hurry up and get out of town. Look at what happened with COVID. Some of those nurses couldn't leave. They couldn't go back home. They had to stay at the hospital or they stayed at hotels. So think of this very clearly, what you're going to do. It's not something that you need to take real lightly. It is going to make a difference. I do know people that have been fired for not fulfilling that role. So the other thing that boards, ANA wants you to know is that you need to make a best plan for yourself. You need to have your bag packed. You need to know exactly what you're going to do. And for that, I don't worry about much of you guys, because you live down here. You've already got your stuff stacked that you need by May. Everybody's got their flashlights, their canned goods, usually their water. Very seldom do we down here wait till the last minute to get that. But there's always going to be another emergency or disaster like COVID that happened, and you had to plan for it. So ANA wants you to understand something else, and they want you to think about this before you go to work. And during times like this, these disasters, you're going to probably not have enough resources. You need to be aware that you're not going to have enough resources. They may not be able to get shipped in. How are you going to handle that? Can't say, well, I can't do this because I don't have that kind of tubing. You're going to have to make difficult patient care decisions. Who's going to get this bed? Who am I going to treat first? What am I going to do? And you need to understand the ethics that are associated with that. Even though the rules may change during a disaster, your ethics remain the same. Okay, you're still going to be professional. You also, during this particular time, you may not be able to abide by HIPAA violations. If you got 800,000 people in a spot, you don't have a private room to go discuss something. So discuss what you need to know so that you can treat them. The other is that you may get pulled to other areas. Expect that. A year ago, well, actually, I think it was in 2020 when COVID first came out. The nurses, the students at this particular time now, they were already practicing. They gave them an emergency okay to start working as a nurse, those that were in good standing with the school and were going to pass. So things can change, and you may have to do things very different during an emergency. You may not be charting every hour on the hour. You may not be changing your IV tubing every 3 days. It may be every 3 weeks because you don't have any tubing. All those things we taught you not to hook tubing to tubing to tubing. Well, you saw during COVID, they did that because they ran the pumps all the way outside the doors. They wrote on the windows of the doors medicines on those patients. So things can change during a disaster. And the basic thing of that is you got to go with the flow. The other thing, and Dr. Udo really brought this across very good, is ANA wants you to realize you may have to deal with some things that you don't want to deal with. You need to know that you've got to protect yourself. You've got to discuss what went on that day. So if something happens during that day, it really should be discussed that day, not a month later. A month is too long. So you want to have these debriefings that day. This also is the time that managers should not be screaming at you or confronting you. What they usually do, any of you that are going to work in the specialty areas like ER, they have code sheets. And they will fill those code sheets out. What time somebody came in, what they did, what time they did this, what time the blood pressure was, what time did the EKG was done, what time did they go to x-ray. And they compile all those reports. And then in the hospital, they meet once a month. There's a team. And they look at all of that information and decide where do we need to improve at. They also do this during the disasters. When you have disaster drills, they compile the information, then they'll take it to administration and they'll decide what they need to do about it. On all of these disaster drills, they should not be confronting you. You can discuss debriefing. And you guys know that everybody here does that. The fire department does it. The police department does it if something bad has happened that day. But what they want you to do is make sure that during an emergency, things may change and you may have to do different things. However, you cannot step out of your role. This is not a role where you can, it's a disaster, I can now be a surgeon. I'll just suture that up. I'll just intubate that patient because there's no doctors around. You still cannot do that. So whatever you can do in your role, you can do, but you can't assume new roles during an emergency. So 4 phases, right? Mitigation, what came after mitigation? What are we doing after
Preparedness.
we're preparing, right?
Mm-hmm.
And then we're in the emergency thing. This is when the storm's hit. We're already, done. And then the last one is recovery. So you will see, even like now in the recovery phase, they have sprung up. They had all these COVID clinics all over the place. That's all they did was COVID. That is in the recovery phase. So just be sure you know that. Let's move on real quick to triage. All of you for the last couple of years have been taught to go to your sickest patient first. Well, now I'm going to teach you not to go to the sickest patient first. We're going to do what you call reverse triage. And this is a triage that they use during disasters. It's when you want to do something that you can treat the most amount of people. You do not want to spend all your time or supplies on one person. You want to save as many people as you can. The easiest way that you can do this is called the RPM. And I want to share something with you. My son gave this to me the other day, and he's listened to my lectures for years. And he told me the other day, he said, "Oh, Mom, you got to share this with the students." And it's a saying, and it shows this professor on the board, and he's got all this writing on the board, and he's pointing at the students in class, and he's saying, "Your paper must be a minimum of 5 pages," which we've all heard that, right? You got to have minimum of all these pages. Then below that caption, it says the real world. And he's saying, there's another guy, and he's saying, "Explain it to me in 7 seconds or I'm out." That's how I want you to think of triage. It is not a long, detailed process like your narrative notes. This is get in and get out. You only have a couple of seconds to make these decisions. You're not going to sit there and ponder. You're not going to sit there and do CPR. You're not going to sit there and give them oxygen. You're moving in and out quick. And the easy way, if you can remember this, is the RPM. It's a training wheel. The R stands for respirations, greater than 30. The P stands for perfusion, greater than 2. And the M stands for mental, unable to follow simple commands. And those are the 3 things that you're going to decide in a split second what color and what chance this patient has. And if you think of the RPM, if you forget those initials, think of that gauge that you have on your car that says RPMs. When you press the accelerator, the RPMs go up. That's the same thing you're going to do here. If your patient has high RPMs, he is going to be someone that needs to be seen within an hour immediately. We are going to make that patient red. Traffic light, you've got to stop and treat the red. If his respirations are 28, he's red, unless he's just hyperventilating because he just wrecked his $100,000 car. If you do capillary refill and it's greater than 2, he is going to be red. Why? Because we have a perfusion problem. He does not have to meet all 3 of this criteria, just 1. If you tell him to go sit down over there and he can't do it and he's still wandering around, he is going to be red. And there's a difference between being anxious and nervous and terrified and just not even knowing where you are or anything else. You should know the difference. That's all you're going to use when you come up on these people. Now, the worst one is going to be black. We all know that, right? Black represents funeral. Black dresses, everything is black. This is going to be a person that his injuries are so bad, he's not going to be able to survive them. And you're going to know that. My guess is his respirations are probably going to be over 30. He's probably not going to have a radial pulse. He's not going to be awake. He is going to be black. If you come up on a train wreck and the patient is awake, but you see he's pinned underneath the wreckage and he's literally, and I don't mean this to sound bad, but he's literally cut in half. You know he's not going to make it. He's going to bleed out in probably 5 minutes. There's nothing you can do for him. You're going to have to make him black, put a mark on his head, and move on because you have other people to treat. You can put a mark. Women usually have lipstick in their pockets or something. You can put that on it and mark it on his head. Why do we do that? So that when somebody else is coming behind us, they don't go to the same person and waste 2 or 3 more seconds assessing him. They can move on. They can see that he's already been marked as black, no chance of survival. They're going to move on to somebody else. Remember, you want to save as many people as you can. If you've got thousands of people at the same time, you can't waste your time on this. And this is the hard part that you need to think about is how, before it ever happens to you, how you're mentally going to handle this.
Ms. Dickerson,
Yes.
this makes so much sense because before COVID, we weren't able to process this and think about this. And I guess as an LPN, I wasn't really taught this, but I would be so mad when you would save someone that was walking around and this person was so sick and we couldn't do nothing. They were like, no, we gotta wait. You know, we don't have the bed for this. We can't do this. And I was so upset and so mad on many days. But now looking at this and you're explaining it, it makes so much sense.
Thank you, Crystal. You're so very right. You guys are so different. The last 2 years that I've taught this has been so, the students have been so different than before. Because if I discussed this before on pandemics, they looked at me and laughed. if I would have told them 2 years ago that the whole country was going to shut down, they probably would have said, well, I do know what they said. And so you need to think about it. There were a lot of things that were going on. You know, you can't, this isn't the time you could say, I'm taking care of 5 patients. I was only promised 5, and I'm not taking care of these 15 patients. You do what you've got to do, but you need to think about it because you're going to be in that position. And the way things are going, we had COVID, then we had Ida. Who would have thought we'd be out of school for a whole month? Now we've got all this going on with Ukraine, with chemicals, everything else, radiation. So now there's going to be a third coverage on that. And I'm going to get to that on the second part. All right. Now, hopefully you know by now the difference between a radial pulse and a carotid pulse. If you have a absent carotid pulse, you are going to be black. Right? If you have an absent absent radial pulse, you can possibly be red. You might be black, but you're going to have to look at the rest of the symptoms. But if they're awake and alert, they can go as red. And red basically means immediate. Are you going to get to them immediately? Probably not if there's hundreds of you. And these are usually airway issues, chest pain issues, burns, things like that. Think of airway, and that's going to make this person red. Now, there is one little trick to this. You get to do one thing when you come up on these people. If you come up on a person and he is laying there and he is not breathing, you get to do a head tilt on him. Sometimes with a head tilt, his respirations will come back because it will move his tongue. That's all you get to do. No CPR. No matter what, you cannot do CPR unless that's your only patient you've got. And there's nobody else, no other patients. But we're talking about mass casualties. You get to do a head tilt, no respirations after that head tilt, he is black.
That's so a head tilt, not a jaw thrust, just a head tilt.
Just a head tilt.
Okay.
Just moving his head. Now, can you assign people to do something? Yes, if you got enough people, you can assign somebody. Once you start CPR, you're doing CPR. You can't stop. So I don't know how long you want to do that. The other is if they have a mass bleed, you can get them to put pressure on that. You can help them with that part. You're not going to do that. You're going to move on, but you can assign this. And so now we're down to 2 colors, a yellow and a green. So let's make it easy. The green, like a traffic light, you can go. If you can walk, you are green. It doesn't matter. If you can walk, you are green. And what you will see in these disasters, if the ambulances or EMS was there before, they have colored tarps in these 4 colors. And they will move that patient to those colored tarps. And then as people are coming to take them to the hospital, they will go probably to the red first, then the yellow, and then the green. But green, if you can walk, you are green. Obviously, you've got some kind of perfusion. You can breathe, evidently, so you can walk. Now, the next one is yellow. And here's where you're going to have some difficulty between the yellow and the red. But remember those RPMs I was talking about? Go back to those RPMs. Or his respiration's greater than 30. No. Is his capillary refill greater than 2? No. He has good capillary refill. Although his arm is broken, he has good capillary refill. He is going to be made yellow. Yellow basically stands for delayed. It really means, they can wait past that golden hour. They're not going to like it, but they're going to survive. They're not going to die. And so, if you come up on a patient and he's not breathing, you're going to do a head tilt, no respirations after a head tilt. He's black. If he starts breathing, then he can go to red. Black stands for absolutely probably no survival. Massive, injuries. They're not going to survive for those injuries. And you got to remember, a lot of these people are in shock. Their adrenaline is flowing. They don't know that they don't have any arms. They don't know that they don't have any legs, or that their insides are completely blown out from a blast. But they're going to die in a few minutes. That's very hard to leave that patient and move on. There is nothing you can do for them. There's also these other triages where if you had thousands and thousands of people, you're going to be divided into two groups. Those that are going to make it and those that are not going to make it. Two groups. But these are tags that they use, that EMS uses, and these colors, these 4 colors, are used worldwide. So if you went to Ukraine now and worked as a nurse, you could actually label the same colors. It is worldwide. Some use a 5th color, some use some extra colors, but that's way too complicated. These are your basics. And that's all you need to know. When you're answering a question, I usually try to find the dead person first and the walk-in person. That gives me a 50-50 chance after that between the yellow and the red. Then I decide, if by the RPMs, what I'm going to make this patient. Example, you come up on Demetrius is laying over here. She's screaming, her arm hurts. Deanne goes over, checks her pulse, her radial pulse. She has no radial pulse. It's a compound fracture. It's open, it's bleeding, but it also has no pulse. What are we gonna make her?
Red.
A yellow. Okay. Now,
Red, yeah.
Deanna's still triaging. She comes up on Jared. He has a broken leg, but he has a pedal pulse. What color are we gonna make him?
Yellow.
Yellow. Does everybody follow me on that? It doesn't have to be so specific, and I'm not going to trick you on the test and give you some complicated thing because, like I said, this is not a 5-page paper. This is a 7 seconds or less thing to get out there. You need to do it quick. I don't want you to spend 20 minutes trying to figure out which person's going to be black. If he doesn't have a carotid pulse or he has a thready carotid pulse, he's probably going to be black because I don't think there's a whole lot you can do for him. And I want you to think like it's a mass casualty, not like you're just up there with one person. Now, remember this because when we go back to radiation, there's going to be a slight change in radiation injuries. But this is worldwide. This is where you can use it anywhere. You get to the scene, you can start telling people where to go. You can start triaging them. And hospitals use these, EMS uses this. My guess is as soon as you have an emergency, these are going to be out all over. And these are actually the ones that NOHD was using. And they have tags where you can put for the property ID and another tag that scans where the accident occurred, what kind of injuries he has, what hospital you send them to. It's really, it's a really cool thing. And usually when I'm doing a live lecture, I have plenty of these to go around, but I can't exactly feed them through the computer. So I should have some on me. So if you guys are, well, we're not doing Jeopardy live, I forgot. If you need to see them, I will have them this afternoon in my in-class lecture.
Ms. Dickerson, just to clarify I guess more so a little bit more the difference. So I know you said for green, you're a walkie-talkie, you're okay, maybe you have a brush burn or something like that. For yellow and with delayed, it would be maybe a broken bone or something, but overall they're okay.
If they can walk, they are green.
Okay.
If they have a broken leg, they're sitting down, I assume. So, but that's when you start looking, you got to rate it down to those RPMs.
Okay.
And it's usually going to be a perfusion problem and a broken bone. That's going to be your deciding factor if you're going to make them red or yellow.
Gotcha. Okay.
You can, and for an example, there have been people that have had run off the road in the mountains and been trapped in their car for days with a broken arm or a broken leg or whatever. They survive for days, but they don't have a perfusion problem. They're still perfusing enough to their extremities where they're getting blood. If they were not getting that, then they would be red and they probably wouldn't be surviving for days. You hear about it all the time when the hikers, you're looking at young, healthy guys and they fall off their cliff and they're stuck down there for 2 days, whatever, till the rescue team can get to them. But still, those people are probably going to be yellow because they don't have a perfusion problem. I think that anytime you got a perfusion problem, think about it. It's going to cut off the blood flow to that arm. Once you cut that off, then it turns into gangrene. And this stuff, look, you can get septic in an hour. So that's, it's not, I'm not going to make it to where you really have to think about it. You know, I'm not, at least I hope that they're not like that. I try very hard not to do that because that's not the purpose. The purpose is for you to be able just to run through and decide what color they are. And we're going to do at the end on the next hour, when I wrap everything up, we'll do some examples. Okay. When you leave this lecture today, you're going to be able to walk out that door in triage. You're going to be able to walk out that door and know what to do if there was a nuclear attack. I can't say you could survive it, but at least you'll know what to do and how to take care of yourself and your other person. Like I said, 7 seconds or less. We're not doing 5-page reports. It's quick, in and out. All right, y'all take 20. We'll come back at 9:30. Okay, I'll see y'all at 9:30. That is, you look alike. Okay, guys, everybody's back, I hope. There's a couple of things that I just want you to think about. Now, I was trying to figure out an easy way that you guys could learn this in 50 minutes and be productive with it. So we're going to do it like this. I want you to write this stuff down, and we will come back to it a little later. Pretend Jared is the student in class, because he's the only one I can see right now, other than Steven up there. All of you guys are sitting in class, and this is what you write down, because this is all that you got out of class. The boring stuff. Historical accounts. You don't have to learn this particular stuff, but history says that in the 6th century BC, they used a chemical agent to poison the drinking wells of enemies. The Islamic Tartar nations provoked an outbreak of Black Plague in 1346. The Black Death, when this happened, it's killed 1/3 of Europe's population. Smallpox, write this down. Red spots on the tongue. Anthrax, black area on arm. Botulism, double vision, slurred speech, stiff, plague, swollen lymph glands. That's what you got out of class when you were taking class last week, and this is all that you got, you remembered that you wrote down. We're coming back to that, okay? All right. Now, where'd Jared go? I lost Jared. Oh, there he is. Okay. Jared and Jessica, we are working at a chemical plant, a nuclear plant. You guys decided y'all wanted to go into occupational nursing. Easy, right? All you got to do is do some pulmonary tests, some physicals once a year. You can sit back and play on your phone, go shopping on the internet, do all of this because nothing happens at these plants, right? And you already had that little bit of training that you got last week in school, your new grads. Well, let's see how much I'm going to be your preceptor as the seasoned nurse with you two new nurses. This is your first day on this job. Did you know that everybody within 10 miles of a nuclear plant have to be evacuated if there's a leak? You have to go and protect all your food. And now, that used to be the old rule. Now, you have to evacuate 50 miles out. How many nuclear plants are they in the US? There are 65. And 14 out of 20 of those are in the largest metro areas in the country. 1/3 of Americans live within one of these 50-mile radius. 1/3. We have several in Louisiana. How many of you know where the closest nuclear plant is to you? Do you know, Jessica?
Yeah. Maybe, I don't know, maybe if I'm in Kenner, I was thinking somewhere near, Destran.
You're thinking, right? What, Jared, where do you think the closest one is? Or have you even thought about it?
I know, aren't we? We're sandwiched in between a couple. I don't know how far out they are though.
Deanne? All right. There is the Waterford, which is in Kelowna. And y'all don't have to write this down. You don't have to know this. I'm just telling you that so few people actually know that they live so close to nuclear plants. And you need to know that because what? You're a nurse and you're going to be working in a hospital, other than these two that have decided to come and get the easy job with me working as an OT nurse. The other one is Bartlett, and that's in Walker. Another one is in River Bend, St. Francisville. There's another one in St. Landry, another one in Port Gibson, and another one where they built fallout shelters is in Baskin, Louisiana. There is a place, the closest fallout shelter for you guys here was a place on the corner of Lakeview and Pontchartrain Drive. They had built as now I don't know how many people they thought they were going to fit in it, but that was where one was built. So you kind of like need to know your territory, like I tell those students that are in my clinical, you need to know the equipment that you're going to be working with on that floor really well. Spend time in the supply room. You need to figure out what you live close to and what could happen to you with all of that. All right, so let's start at the beginning. All of a sudden, Jared and Jessica and Sharon and Crystal and Deanne are all sitting in the nurse's station. All of a sudden, we hear a huge boom. Jared, what are you going to do? Honestly, what are you going to do?
I'll probably freak out.
But what would any
That's
of
honest.
you do? What would any of you do?
I'm going to try to see where it's at. Yeah, I will run to the window.
Run to the window. Well, I have news for you guys. That's the worst place you could go. You do not. Go ahead.
They could shatter, right? I mean, they could.
You do not run to the window. Nuclear contamination can come through glass. You run as far inside a building where there's no glass, down as far as you can go, because air rises. You're going to go out into the hall or stairwell. But that's exactly what people do. They do run to the window. And during Chernobyl in the Ukraine, when they heard this big boom back in the 80s, they have this big bridge, and people ran over to the bridge so that they could see it better. Well, everybody that was on that bridge died of radiation poisoning because they got that close. So, first things first, you get away from windows. Now we have a problem because Jarrett ran all the way to the window. Guess what he's got all over him?
Radiation poisoning.
He's got radiation all over his clothes. So we tell Jarrett, you got to take off all your clothes. He says, but I don't have any extra clothes to wear. That's okay. If you take off your clothes and you shake them, you can remove 90% of the radiation. 90%. That's a lot. And then you can put your clothes back on. But if he had clothes in his locker, he could go and get clothes that is in his locker. If it's in a locker, if it's in a dresser, if it's in a drawer, it's safe and you can put that on. It gets exposed for that 1 minute that it just comes in on you. Now, well, he doesn't have any extra clothes, so we're going to have to decontaminate him. And he is going to have to take a shower. What instructions would you give him on where to start taking the shower? Jessica?
As far as like what to clean first?
Yes.
Well, I mean, I think he would have to be careful not to get anything in his eyes. So he might have, I would say top down, but he still would have to find some way to clean his face and hair without it running into his eyes and mouth and everything.
Okay. We're going to start at the top of his head, his hair. It's going to have to be washed. Are you going to wash it with an alkaline soap, an acidic soap? Which one?
Alkaline?
A mild soap.
What did we learn about alkaline things? They burn, right? So you're going to use a mild soap. What kind of water are we going to use? Are we going to put cold water on him? Hot water on him? What kind of water are we going to put on him?
Cold?
Warm. Lukewarm.
Lukewarm. Okay, Jared, you are just getting more radiation poisoning. What happens is if the reason you do not use cold water is because it closes the pores. And if it closes the pores, it traps that radioactive material. If you use hot water, it opens the pores and the radiation goes in. So you use lukewarm, mild soap to wash. Well, Jared, of course, is a little bit different than Jessica. What would be different about washing your hair versus Jared washing his hair? What do you usually do when you wash your hair, Jessica? What do you do after you wash your hair?
I mean, I would dry it, but not with a
Before
dryer.
you dry it, what do you do?
With shampoo?
Okay, we put the shampoo on it. Who said conditioner? All right, Demetrius. Well, we're going back to critical thinking. You would not use conditioner. Why would you not use conditioner? Because, go ahead, I'm sorry.
It closes the pores in the hair.
It does. It seals it. So you got the same problem with it closing it. So no conditioner, which is going to be very hard with people that have super long hair and it's going to be all tangled. So you know that that's going to be a mess. But that's what we're going to do. If you have while Jared was running from the window, when we told him to get away from the window, he fell and he scraped his knee really bad. We're going to cover that knee. We are not going to scrub it. We are going to cover it with something because when we're washing down, we don't want that to run into that opening. Make sense? A lot of when they teach these, they have in their kits water flossers, for your teeth. And that's what they use in hospitals and other places to wash those out. Because you want something that's long, that you're not touching your hand into their sight. Because you don't want that radiation on you. So you're going to use either tongs to put that dressing on, or you can use one of those dental flossers. Like you all carry that around in your purse, I know. But that's what they are supposedly designed for to do. All right. We've got head to toe, no conditioner, mild soap, lukewarm water, tepid water. He got dressed. Now we did all this and we're hearing all this commotion going on outside. So we all run outside. Jared sees this patient laying over on the ground. First sight, not breathing, not moving. Exhale. Okay. He sees another patient laying on the ground, breathing. Which one are you going to go to first? The breathing patient. The one that's breathing. The rule changes in a radioactive thing. You can treat that person first. You treat life-threatening injuries first during a radiation or nuclear event.
So you go do your head tilt.
You could go do your head tilt. If so we did that. What, and he has respirations back. What color are we gonna make him? Red. Red. Because just because it was a nuclear disaster doesn't mean that there were not other injuries. We're going to have dirty bombs, those kind of things with it. And from those, you get blast injuries, which are terrible. So you come up on another person. His leg is blown off. Obviously, we don't have a pedal pulse, right? Because you can't check it. But he's awake. His respirations are 20. But you know that that femoral artery is bleeding out. You can see that it's bleeding out. You can get someone to put pressure on that leg. He will be red. Hopefully, you can get him within an hour. All of these people are going to have to be decontaminated. So you got 500 people at this plant, and the word goes out. You're working in the ER, and the closest ER, guess who all you're going to get in your ER? Everybody that can walk they're not going to wait for an ambulance. They're going to hightail it over there. When they had the mass shooting in Las Vegas, there were like 900 people injured and 400 and something shot. The people that were shot that could walk, they went to the closest hospital, whereas they really should have been triaged somewhere. And those people, when they go to that hospital, then the old rule comes into play. We're going to save the person that's, injured the most. Only out in the field is it where the green walking are seen and taken off. Now,
Ms. Dickerson, question. While with the nuclear and radiation, we're gonna go see the head tilt first. Say we were on the scene of the last tragedy, and it was the person with the leg that was, broken, and we had the person that wasn't breathing, but we came to the person that wasn't breathing first. We wouldn't do that head tilt
we
first.
still do the head tilt.
Okay, so we would still.
But if I know it's complicated, but the trick is if it is a radiation contamination, you treat life-saving injuries first. That doesn't mean CPR and all of that. It means life-saving, something that you could do, pressure on it, tilt their head, do something, but I have it referenced, it's called REM, REMM, and that's all on radiation for the government, and it's hundreds and hundreds and hundreds of pages. There must be 30 pages to tell you how to wash radiation off. And that's why I did not put it down for recommended reading, because I didn't want you guys to spend all your time reading all this, because that's real in depth, and that's going to be those people that come in, those hazmat guys that come in, and they'll take care of all of that. But we're doing the simple stuff. We're going to save as many people as we can, and we're going to know how to protect ourselves. Jared knows now not to go to the window. Okay? So we're going to drag his butt whenever he starts going to the window, screaming. And it's normal human behavior. That's what everybody does. But you got to be aware of where you live, what's going on, and what you need to do just in case, and not worry about it, oh, well, I'll deal with it then. Then you're going to panic and you're going to do like Jared and run to the window and look. So Jared's sending all these people to the hospital. And Deanne is the nurse at the hospital. And she says, okay, here comes one he has a blast injury. He's missing his arm. He's missing that. And Crystal brings in this patient and says, I don't know what he's got, but he has these swollen lymph glands, and he's complaining of a fever, headache, chills. Remember, swollen lymph glands, like the mumps, like mono, they hurt. And you're thinking, okay, well, he could possibly have, I don't want whatever it is he has, he could possibly have the plague. So I'm going to dress all out in PPE and put him in isolation, right? Because I don't want the fever, the headache, or the chills, or those swollen lymph glands. And I'm talking about swollen lymph glands, not just a little bit where you got to feel them, where you could see them down the hall. And you think, wait, where in the world could he have got that? Well, because you read extra last week, you went and researched it instead of just looking at what you got in class, swollen lymph glands for the plague. You went and researched it, Deanne, and you saw that the plague can come from rats and fleas. You go, okay, well, if he gets really sick, remember that saying, avoid that like the plague? You don't want to be near it. You don't want to catch it. These people go into shock. Then they'll go into DIC. Then they'll get septic, and then they'll follow on in a vet. Remember from earlier in the class where you wrote down that the plague killed 1/3 of the people? So you do remember a few little things. So you go, well, I think he has the plague, so let's put him in ISO. Then another person comes in. Sharon brings in this patient and says, I don't know what's going on. Between all those blast injuries and the radiation, I've got a person that's coming in here. Look, he has red spots on his tongue. Uh-oh. And he's got weepy looking things on his face. And they're dripping. Ooh, I don't want this. That's gotta be painful, right? He's going in isolation. PPE, ASAP, and isolation. Protect yourself first. Remember that? Always protect yourself first. Well, if he's got those pustules and they're weepy and crusty, he's probably running a fever because it's probably, he's probably got pain because that looks painful, right? Mm-hmm. I would have severe anxiety if I had that all over, so you better give me something to calm me down and make sure that I'm in ISO. Those red spots. Then Crystal brings in this other patient and says, God, I just don't know what's going on. It's like the world is falling apart. Here's another person that came in, and he's got this black area on his like escar, and it looks just terrible. It's like about a 3x3 area with this black thing, and it's got like a spot inside it. And you ask this guy, his name is Mr. Anthrax, and you ask Mr. Anthrax, what do you do for a living? Mr. Anthrax tells you he works on a farm. He's a livestock worker. Well, we know that anthrax comes from the word anthracite. Anthracite is a black menu that lives in the ground, and it can live there for millions of years. The cows eat the anthracite. The worker, let's say they have sheep, they shear the sheep. If they have no gloves on or a mask on, they can inhale those spores. All right, so Mr. Anthrax, are you using a mask and gloves when you do this?
Oh yeah.
It can also be man-made. You remember, you went back because you just didn't like that short lecture on anthrax. So you went back and looked it up. And it can also be man-made. Cipro is the treatment, and it's for like 60 days. It's a long, long time. Does he have to go into isolation? No, he does not need it. They also had that the man-made anthrax was the powder that they were shipping in mail packages years ago. All right, now,
Ms. Dickerson, I have a question.
okay.
So when the spores are in the ground, do they have to come in contact with something to become infectious, or they're already infectious?
It's already, supposedly they're not supposed to let those cows graze on those infected areas. You can't use it. It's usually off limits.
Okay.
You'll see a lot of farms where there's nothing on them. But, it stays for a billion years. It doesn't go away. Now, another person comes in. By now, you're seeing a pattern, right? All of a sudden, you remember that lecture on those biological weapons, the plague, the anthrax? Oh my goodness. Now this person's coming in and he's got double vision. He's got slurred speech. He's bent over super, super stiff, can't straighten up. And his name is Mr. Botulism. What do we know that botulism causes that stiffness?
I'm sorry.
Go ahead.
It's a neurotoxin.
It is, but it also affects your lungs. So what do we have to worry about? Breathing. He won't be able to breathe. It's going to paralyze his muscles. And how do we get this? Through contaminated water or food, canned food. These people, if they're going to have paralyzed lungs, they're going to go on a vent. And there's not a whole lot you can do for them other than supportive care. It is very terrible looking and it's very painful. And usually, especially if it's children, they don't make it. Remember last year when you were in 3 that you don't give children under the age of 2 honey. I'm sure y'all have heard that. Because it's preservative free, and you can have the botulism for a child enough in raw unfiltered honey. So children under the age of 2 should not have anything from honey. Now you know, you're thinking, oh my God, this must be, and this is really far-fetched, so I'm just trying to exaggerate it. So now you're saying, oh my gosh, they used all those 4 biological weapons. Those are all category 1 things: smallpox, anthrax, plague, and botulism. They can all be made in the lab. They are cheap to make, and they can kill a lot of people in a very fast way. Look what supposedly COVID came from the rat. Look what happened. Just, not saying it did, just saying that, in the thing. The smallpox, there are only 2 countries in the US that have the smallpox vaccine and the actual bad smallpox, and that's Russia and us. And it's all guarded. It's locked up with these big heavy chains, and the guards sit there and guard it. So why would they use these? They're easy, cheap to spread out. You can put it in the food, you can put it in their water. So now we know something bad is going on. We're having some kind of bioterrorism thing happening. What are you going to, you have all these people in here and you don't know what to do. And Jared is the new nurse. He rode in the ambulance over to the hospital with them because they had evacuated everybody at the plant. We have to delegate some nurses because, our 5 nurses in the ER is not enough to take care of all these hundreds of people coming in. So we're going to pull some nurses from the floor. And you have these patients. You have an intubated patient. You have a patient that needs an IV. You have a patient that is on a nitro drip. And you have a patient that has an open wound. Which one of these patients are you going to give the labor and delivery nurse?
The open wound.
The open wound. Why would you do that? Because you were so nice, Sharon, to do that.
Because she's coming from labor and delivery, so she's used to blood and she should be able to handle a little wound care.
Now, that's the first time I have heard that explanation, used to blood. I didn't even think about that. But we can all do wound care, right? Even if you're a psychiatric nurse, you learned how to do sterile technique. That you learned that in nursing 1. You definitely don't want to be thrown in and taken care of it. The best way that I see delegation is I put myself in that shoe, and I could tell you, I don't want an intubated patient because I haven't worked with vents for, years and years and years. I don't want an IV patient because I haven't started IVs, although I used to start them. I haven't started them in 30 years. And nitro, the last time I hung nitro was years ago. I don't want to do that. And so the easiest patient to take would be the wound care. And I don't know why students always want to go for titrating medicines. And if you've got to titrate a medicine, it is probably a dangerous medicine. And you sure don't want to have any nurse that hasn't dealt with it in a while. like your case managers, they were all nurses on the floor. But once they go back and they're working in their offices, they can't remember how to titrate things. It takes a little while for the IVs to come back. This is not the time during chaos to have these people doing these things. Are we clear on delegation? Okay. All right. Let's do a couple of these and see where we go with that. What color a tag is this going to be? An open fracture to the left femur, active bleeding, and a weak pedal pulse.
Red.
Red. Good. Superficial scalp black, bleeding controlled, respirations 18.
Green. Green.
Okay, very good. Left arm deformity, 2+ left radial pulse, respirations 22.
Yellow.
Yellow. Apneic, thready carotid pulse,
Black.
pupils fixed and non-reactive.
Black. Black.
I just want to be sure that you guys know that the difference between a carotid and a radial pulse, and pupils that are even and reactive are very different than pupils that are fixed and non-reactive. Just saying. Now, I'm the manager. We had this terrible accident happen today. What are we going to do this evening? What am I going to call all of you in for?
Debriefing.
A debriefing. Okay, well, you know what? Jared didn't go to that person first. I saw that he made a mistake, but I didn't confront him. I just let it go. I saw Crystal took too long to do her stuff. What am I going to do with this information? How am I going to handle this?
You can bring it up, but not necessarily call anyone's name. Just say what we can do better. Next time, maybe we need to triage our patients a different way and maybe make sure everyone understands the whole triage process.
Right. I'm going to observe this, and I'm going to report what I saw to that upcoming hospital meeting and see that maybe we need to train the nurses to do something a little bit different. What about, I don't remember who brought Mr. Plague in, but remember, the plague was caused by a rat. He got this patient that was bit by a rat. So you're going to go in his room. What's the first thing you're going to do before you go in a patient's room that has the plague?
Apply PPE.
Right, because remember, avoid that like the plague. What color is this patient? A patient crying with blood oozing from an abrasion to the cheek.
Green.
A patient that's alert, absent radial pulse, obvious deformity.
Red.
Patient that's awake, respirations 26, mental object protruding from the arm, 2+ radial pulse.
Green. Yellow. Yellow.
Patient unresponsive, who remains apneic after repositioning airway.
Black. Black.
Tell me which one of these people, and if there are any of my students in here from my clinical, and y'all miss this after everything I have preached for every one of these tests, I'm going to wring your neck. How are you gonna prioritize these patients at a disaster after triage? Okay. Alert and unable to recall their name or day of the week. Alert, crying, deformed wrist, capillary refill greater than 3 seconds. Unresponsive, apneic, and no palpable carotid pulse. Alert, breathing with burns to the face and anterior neck and chest. Which one are we going to see first?
Number 4, the alert person, the burns.
The one with the burns, right? Because that is an airway issue. What do we know about burns? They don't have to have any injuries on the outside. We worry about their airway. Always go for that airway first. Then you've got another one that's got a capillary refill. Which one would you see last? The no carotid pulse, right?
Mm-hmm.
So you see, pick your airway first, your dead person last, and then you only have to figure out 2 more. With anthrax, the vets, they actually have a vaccine that the vets take that work with livestock. Those taxidermists guys that stuff the dead animals, they usually will take a vaccine too. And so they need to wear it's an airborne thing. Remember, the anthrax, you can blow the powder. It has that white powder that they blew, that they put in the packages in the envelopes, because it's airborne. So they're gonna also need some a mask. Let me see. What else was I gotta go? The 4 phases. I have this chart. It should be listed. It's there to help you. Don't spend hours and hours memorizing it. Think about it, and let's do that 7-second rule. That RPM. If they don't meet that criteria, then you know what to do. Don't make this like an ACLS complicated algorithm. But it is there for those of you that have to read stuff. There's a lot more stuff on the contamination. Like, I never realized it could be so complicated that the clothes, if you take their rings, their watches, they have to go in a sealed bag. You have to write the date and the time that you put it in that sealed bag. It has to be where it flows downhill into a certain area. They're supposed to have bags to catch this water. So you don't want to be standing downhill from wherever that is that's flowing there. Stand on the other side. When Chernobyl had the nuclear thing, it went all the way to England. The air carried to England. And of course, y'all, I'm not even getting into the Chernobyl thing, because you see it all on the news now. There's a HBO series that I highly recommend that you guys watch when school's out. Pregnant women, please don't let anybody that's pregnant handle anybody that has been exposed to radiation. It will cause defects to a fetus under 6 months. Bleeding starts. It's a terrible, terrible way to go. There's another really good article on the Hiroshima, how bad that was. It killed like over 100,000 people. And of course, with politics going on nowadays, you really should know this. So now, as you walk out this room, if something bad happens, you know not to run to windows, not to run outside the building and look. You're supposed to stay inside the building a minimum of 24 hours or until they tell you it's clear. No conditioner, tepid water. You could shake the clothes off. 90% is removed since Jared didn't bring his extra pair of scrubs. And then be on the lookout for blast injuries that could occur. Expect blast injuries with this. You may expect the smallpox, the plague, the people coming in with those symptoms, those red spots on the tongue, need to go in ISO. The plague with the swollen glands need to go in ISO. Anthrax has that black mark. It's a real specific black mark. And you can't miss it. And they need, if they're working around animals, they need masks, protect their respiratory because it is airborne. Your 4 phases, what you're going to do in those 4 phases, your delegation, and I think that just about covers all of my stuff. I'm not going to go into any more detail. Y'all getting the, like I said, the 7-second thing. It's kind of hard to teach hundreds and hundreds of pages in 30 minutes, but at least you should be able to save yourself at least for the first 24 hours. After that, you're on your own. But all right, guys, that's the end of this lecture and for this year. I hope you guys have a super, super good weekend and just take it easy for this week. Just chill out and look at that. And don't go to the French Quarter Festival.
Can't make those promises, but
What, Crystal?
I can't make those promises. But thank you. It was a pleasure. Good luck, everybody, and we made it.
You made it. I am so happy for y'all. Y'all doing super, super well. And I can't believe this is the last day. I mean, it's like it just snuck up on me. I wasn't, it just seemed like it was so far away. And all of a sudden it's here. So have a good weekend. If there's any questions, put them on the discussion board. But like I said, I am not going to make this so complicated. You need to know how to do it in just a few seconds. Okay?
Thank you.
Bye, guys.
Dickinson.
Thank you.
Welcome.